Okay, with that, we'll go right into our update with Kathy and her staff, Cheryl and Jamie. I think you've been given an update already from this week's update.
Yep. Good morning, Mr. Chair and Commissioners. Yeah, I think Cheryl handed out all the latest data. So
all the good news.
Pardon me?
All the good news.
All the good news, yes. So, of course, we continue to have, we have 2,000 confirmed positive cases in Clay County and then 43 deaths. We've been at 43 for a couple of weeks now. And then our 14-day case rate per 10,000 people is 47.61. That's, again, the rate that we work with K-12 schools. So they're looking at that 14-day case rate. They have their school guidance. This is just one of the data points. There's many others. They look at their staffing and how many teachers they have out, how much they can do as far as remote learning. So we meet with them weekly and we go over the rates and all of the other guidance that they have to utilize for their school learning models. Minnesota positive cases, 124,000 now, 2,239 cumulative deaths. Their positive rate went up. It's 5.2 now, reported on October 15th. And then the cases requiring hospitalization across the state of Minnesota is 8,900, almost 9,000 cases, and then 2,414 cases in ICU. Our Clay County, on the next page, we have the currently hospitalized, and there's 3 right now for Clay County residents. So, and then you see the positive cases across the United States, the 8,271,000 and 223,000 over deaths. And then I think Commissioner Mojo asked about the Cass County numbers. That's on page 2.
Thanks for adding that for me.
Yeah, the 14-day case rate per 10,000 people. And so their collection dates are just a little bit different than ours, but the collection date from 9/22 to 10/05 is 57.46. So their 14-day case rates are up, and then they jumped. They have a collection rate of October 5th through October 18th, which is 111.6. So they've jumped up significantly. You know, they're one of the states that has a huge increase in numbers. So not necessarily so surprising that they've really jumped up on that 14-day case rate.
I look at our 14-day case rate. That's collection dates from 9/20 to 10/3. Can they do much? I mean, that information is already almost 3 weeks old. Do we do much with that information? That say that's 47.61. Well, that's 3 weeks old. So
yes, Minnesota is ensuring that we have all of the test rates for that 14-day case rate. Where North Dakota is not necessarily doing that. They're doing more of this real time, but less about that the testing is confirmed and on the tallied in the med system. So our 14-day case rate is going to be a little bit delayed because they're confirming all of the information, so it's going to be 2 weeks out. We will often do a projection from the information we have, and we share that only with the K-12 superintendents because it's only a projection. It's not the official number that MDH posts. So we do a projection for them of what we anticipate might be the case rate. But we stick with the case rate that Minnesota puts out because that has been vetted and confirmed. So it is going to be different. And Cass County has a different learning model and different school guidance. So I'm not sure exactly what numbers they're looking at for changing their learning model. So their numbers, it's not an exact duplication of what we're doing. So their numbers are a bit different. So we'll see what they do. That's just one of their data points as well, but they're also going by numbers of teachers and students they have that are out, either a positive case that's isolating or a contact that's quarantined. So those numbers are a little bit, it's just a number in time or a number in that 14-day case rate. But it's just a comparison, but it's not an exact comparison. Does that answer your question, Mr. Chair?
Well, I just wonder if you use that for anything, because old information almost.
Yeah. It's old information. The K-12 superintendents are fully aware that that's just how it is. So
Very good.
and then you see the tally. We always give you the whole grid that shows the number of total confirmed cases by dates of testing. And all the dates here, those no longer needing isolation, and the active cases. So right now, as of October 15th, 334 active cases. So, we know the numbers are rising. You can see what's happening across the country. They're climbing steadily. They anticipated this peak. They just didn't anticipate that it would come so soon. So the infectious disease and national experts anticipated we'll, have a peak this fall. That's where the respiratory viruses, we kind of see that peak even with influenza, which is a respiratory virus. We always see that in the fall and winter. So we anticipated that would happen with this coronavirus. It just came sooner than we expected. So we're seeing a lot of hospitalization increases across 40 states. We're seeing a lot of cases across the United States. As you see a map, there's a significant number of increases, more than we had hoped for. So the Midwest, of course, we're seeing rising numbers. That's about 45% growth in new infections just in the past 2 weeks. So that's really ramping up. So, with the cooler temperatures, people are outdoors less and indoors more. We just anticipated that we're going to have higher rates. We're also seeing, and it's across the United States, the resistance to masking. That's kind of a challenge to keep that current message out, that we really have to continue. Right now in our toolbox, we only have the masks, the 6-foot social distancing, not gathering in large groups, just staying away from people for less than 15 minutes. Those kind of public health measures are all we have right now until we get the vaccine and can distribute that out to the general public. So our proven public health strategies are to test, trace, and isolate. And so as you heard about our new testing site, and I think Cheryl will talk about numbers, that's good for our community. So we have another means to get more testing done, and so that helps. And then, all of our contact tracers are significantly busy. We are adding additional tracers. They're also working alongside Minnesota Department of Health, who has a number of tracers as well. So as long as we can continue to trace people, give them the right information about isolation or quarantine to prevent the spread, that really is the best measures we have at this time. Any questions about all of that information before I turn it over?
Go for it.
Okay.
Good morning. So as Kathy mentioned, we do have a community saliva testing site in Moorhead now, which just opened up on Saturday, and this is a welcome opportunity for Minnesotans in the area to come and have saliva testing done. So that means no swabbing, so there shouldn't be any discomfort involved in this process at all. It is at the former Thomas Edison Elementary School at 1110 South 14th Street. It is open Monday, Tuesday, Friday from noon to 7 p.m. and on Saturday and Sunday from 10 a.m. to 4 p.m. If you go to the Clay County Public Health Facebook page or the website, there is a link there where you can schedule a test. during these times. If you're not able to do that, they also will accept walk-ins as well. So as of Saturday, I was able to collect a little bit of data. They tested 327 Minnesotans on Saturday with a 9.785 positivity rate for that day. And then on Sunday, they tested 160 folks. So the minimum age, I would say, would probably be about, they're saying ages 4 and up, because you have to be able to produce the saliva and put it into a tube. And of course, younger ages might have a little bit of difficulty with that.
That's a pretty high rate, though, isn't it? It's almost 10%.
It is a fairly high rate.
Of people coming in to be tested and are positive.
Right.
Scary.
This testing is free and available to all Minnesotans. Identification is not required. Insurance is not required. However, they are asking if you have insurance to bring that with you. But they are saying that whether you have insurance or not, you will never receive a bill for this test.
Do you need a proof of residence?
You do not. They ask some questions. Basically, if anyone has a smartphone, they take you through a process of creating your name and date of birth. You create a password on that link. They will ask you if you reside in Minnesota or not. And that way, that is how you will receive your test results, which is within 48 to 72 hours.
So if a non-Clay County resident tests and gets a positive, does that go on that county? Or that?
So we've worked with our Minnesota State, the State Emergency Operations Center, as well as I sent information up to the governor, lieutenant governor, because what we, with this Red River Valley Task Force, North Dakota has provided over 12,000 tests just for Clay County residents at no cost. So many of our residents, when we didn't have testing on this side of the river, were able to go to the static site, which is a site that was set up by North Dakota, paid for by North Dakota. They were able to get testing for free. So over 12,000 of our citizens, North Dakota graciously was able to accept those. And we had worked with the governor's office in North Dakota to make sure that we could get testing done when we couldn't get it done here for long-term care staff, for our higher ed staff, for schools. So to be good partners, I requested from Minnesota Department of Health the ability to allow Clay County or Cass County residents to access this site. At this point in time, there's still discussions about that. So they have not confirmed that they are going to allow North Dakota, Fargo, and West Fargo residents to come to our site. So I'm waiting to hear back. I did speak with the mayor of Fargo, as well as the governor's office in North Dakota, to just, because they were asking, the mayor was sure that there would be a number of folks from North Dakota coming over, particularly Fargo and West Fargo, to access this saliva test site because they do not have one yet.
Well,
And
since you don't need this identification,
well, you need to state if you're a Minnesota resident or not. That's on the thing. So it says if you're a Minnesota resident. So technically, they could turn you away if you say, no, I'm a North Dakota
well, I hope
resident.
we don't start doing
or another state.
Well, I agree. I think that it's important, and that's part of why I included Cass County in our numbers, because this needs to be looked at as a metro-wide issue. My question was just, are the positive cases being reflected in the positive cases for each county?
So Commissioner Mojo, in the data that I gave you, that was strictly for Minnesota residents. There were North Dakotans that went through the test site this weekend, but they did not give me those numbers.
Thank you.
But technically, they will turn them away, is what we've been told by this vault group, that they can turn them away because they haven't determined yet if they will accept, because it's Minnesota paid for, of course, through
Right.
through the CARES money. But because that they accepted all of our Minnesota residents, I felt like when you think about over 12,000 tests, it's a significant number, and a significant number that were paid for by North Dakota. So I felt like we could be good stewards and provide that same service back. So I'm waiting to hear, and once we hear, we'll have more information.
Okay.
Any other questions on the testing site?
Now, is the saliva test, is that going to be the new test from now on, pretty much, or?
It's just another mode of testing, basically. There are still places that are using the nasopharyngeal, which goes all the way up, or the nasal swab, which is just inside the nares, the nose. But now we have the saliva testing site as well. So,
Gotcha.
Is there a difference in the accuracy of those tests?
we are told that it is just as accurate as the swabbing.
And what is that accuracy rate?
90%, somewhere in the 90%
90%.
range, so which is exactly what it is with the other ones as well.
Okay.
Thank you.
Here we go, Jamie.
Okay, good morning. I wanted to share some highlights from the media briefing yesterday with the Minnesota Department of Health Commissioner Malcolm and then the Infectious Disease Director Chris Ersman. So just to point out a few things, the Commissioner of Health wanted to note that there has been an increase in cases, that we saw over 3,000 new cases in Minnesota over the weekend, and that Monday marked the 10th consecutive day of 1,000 cases reported in Minnesota. So really just presenting some data to note that we have seen an increase. We've had a lot of discussion about testing and opportunities for testing, which is important, but she also noted that the positivity rate was growing faster than the increase in testing. So the positive cases increase was 9.6% over the last week, and the testing increase was at 7.8. So just noting that although we're increasing our testing, we are seeing a lot of community spread, and we are finding more positive cases in the community. The Director of Infectious Disease, Chris Ersman, highlighted some guidance on the Minnesota Department of Health for voting. And she said, most importantly, we want to stay home if we're sick, but that we should avoid crowds by voting on off-peak times and remembering to maintain that 6-foot distance, that voting sites have infection prevention measures in place, and the risk of voting in person is limited compared to like grocery stores and gas stations, so to not discourage people from voting. The Commissioner of Health also talked about that we're seeing a high number of cases as we move into fall, and they had hoped we'd have COVID under control as we move into flu season. She said this is a high-risk environment, and we should plan our holiday celebrations with caution. And Infectious Disease Director Chris Ersman really stressed that we should be noting gatherings of 10 or less, and trying to, as much as possible, remember about social distancing even in our indoor gatherings. And then the Commissioner also noted that we have things under control for the most part in our public settings, but it really is social gatherings that are contributing to the community spread. So the things like weddings and just getting together with friends, to go out for supper as opposed to sticking with your household contacts. And so then I'm going to go into some of the guidance that Minnesota Department of Health has as we approach Halloween. And they really are noting that Halloween is a celebration that people enjoy, but to try to help people make decisions, they've categorized activities for Halloween as low-risk activities, medium-risk activities, and high-risk activities. So high-risk activities are the things that we typically think about: trick-or-treating, going door to door. They have what's called a trunk or treat, where people park in a parking area and everybody has the treats in their trunks, and you go from car to car. And then also hayrides with the general population. But those things can be done if we stay within our small group. So a hayride with your family unit is a safe activity. Participating in fall activities, as long as you're staying within your family unit, and then maintaining that social distancing. The low-risk activities that they recommend are, celebrating in your community with a small group of family and neighbors, maintaining the social distancing outside, doing things like a home scavenger hunt, a virtual Halloween contest, celebrating by movies and treats in your home. And then just to remind people that a traditional Halloween mask does not protect against COVID-19, that you need to remember to wear a mask that fits snugly over your nose and your mouth for Halloween celebrations as well. And that guidance is on the Minnesota Department of Health website, as well as the voting guidance.
Okay. Thank you. You must have something else to say, Kathy.
I do, but maybe I should be done. Thank you.
Okay. Okay, well, any questions for the group? Scott, thank you for that update again. And
Thank you.
stay healthy.